Hi, my name is Pooja Patel. I'm a registered nurse and diabetes educator from Toronto, Canada. My purpose with Wellness Chronicles is to provide expert and evidence-based information, tools, and resources for you to recognize, manage, and even reverse those diabetes symptoms. The purpose of this is for it to be easy to understand and to help you integrate healthy lifestyle behaviors into your daily routine as easily as possible. I hope Wellness Chronicles served that purpose for you. Now, this episode, I thought we would talk about pre-diabetes. And the reason why I want to talk about pre-diabetes and spend the entire episode on this is it's because it's the most growing diagnosis all over the world. Now, according to the International Diabetes Federation, in 2017, 352 million were diagnosed with pre-diabetes. And that number is projected to increase to 567 million by 2045. That's going to be 1 in 17 adults will have pre-diabetes all over the world. So that's quite a significant number. Another figure I want to share with you is 1 in 3 adults in the US have undiagnosed pre-diabetes. This is why I feel so passionate about talking about pre-diabetes, is because it's a significantly growing disease. And the second thing is the treatment, the intervention for it is very easily done once you get the hang of things. So why is this? Why is pre-diabetes the most rapidly growing disease in the world? Now, in high-income countries, it's because of the sedentary lifestyle, the highly processed foods, the convenient foods, better data reporting, and access to health services to be able to diagnose. In lower income countries, all of these factors are catching up, along with urbanization. With rapid urbanization, all of these factors are going to be compounded, and which is why even the low-income countries will catch up and will contribute to that huge statistic of pre-diabetes being diagnosed in the world. So what is pre-diabetes exactly? So pre-diabetes is when your fasting sugar or your 2-hour post-meal sugar or your A1C, which is your 3-month average sugar, is abnormal, or it's higher than what it needs to be. And how does that happen? The very first and most common reason why people end up with pre-diabetes is because of insulin resistance. So we talked a little bit about this in the first episode, and insulin resistance is you have a lot of insulin floating around in your blood, but your body is not able to use it effectively. It's not doing its job because the body doesn't recognize it anymore. The insulin is not able to take the sugar from your meal and shove it in the cell to make energy. So if your fasting blood glucose is between 6.1 to 6.9 millimoles per deciliter, or 110 milligrams per deciliter to 124 milligrams per deciliter, or if your A1C is between 6.1 to 6.4%, or if your 2-hour post-meal sugar is between 7.8 to 11.1 millimoles per deciliter, or 140 to 200 milligrams per deciliter, then your physician will diagnose you with pre-diabetes. These are Diabetes Canada's parameters. So the American Diabetes Association's parameters are a little bit higher for diagnosis of pre-diabetes, but according to evidence, starting intervention for pre-diabetes at an A1C between 6 to 6.4% has better outcomes for the future. So how do you know you have pre-diabetes? So as I had mentioned before, the CDC reports that 1 in 3 adults in the US walk around with undiagnosed pre-diabetes. And the reason for this is because the pre-diabetes is actually quite asymptomatic. So you may or may not have your typical diabetes symptoms, like you're thirsty all the time, you're hungry all the time, you're frequently urinating, you are tired, fatigued, dizzy, all these symptoms of diabetes, but you may or may not have these symptoms. What you may have, though, are symptoms of insulin resistance. So some of the symptoms of insulin resistance that we see quite frequently is skin tags under the armpits and the back of the neck, or dark, patchy, velvety skin in the back of the neck. Another thing that's quite common is urinary infections or skin infections that refuse to heal. So if any of these symptoms apply to you, I would highly suggest please go get the blood test done, have your fasting sugar checked, your 2-hour post-meal sugar checked, and your A1C checked. This will give you a good full picture what kinds of interventions you need to implement in your day-to-day lifestyle. So what is the takeaway here? If you are diagnosed with prediabetes, what your physician will recommend to you is to implement healthy lifestyle behaviors and follow up in 3 months to see where your numbers are at. Now, what are those healthy lifestyle behaviors? So let's talk exercise. There was a meta-analysis done that concluded that 150 minutes of moderate to vigorous activity weekly helps significantly reduce A1C levels. The second thing in terms of exercise is if you are sedentary for an hour, try interrupting that sedentary behavior, that sitting, lying down behavior every 20 to 30 minutes. And this also helped significantly reduce overall A1C and that 2-hour post-meal sugar. So that impaired glucose tolerance, interrupting sedentary behavior really helped decrease the impaired glucose tolerance over time. So the second thing is nutrition. Big studies like Look Ahead and Direct, they concluded that weight reduction by 5 to 10%, calorie restriction, and balanced meals decreased A1C by 2% overall. Additionally, a decrease in weight reduction by 5 to 10% of your total body weight led to decreased blood pressure, cholesterol levels, A1C, and improvement of overall health. The third recommendation that I would recommend to you is to limit your alcohol intake. Less than 2 drinks per day or less than 10 drinks per week. This actually helps decrease your cardiovascular risk and helps decrease your A1C. So 3 things to remember: exercise, diet, and alcohol consumption. So that brings me to the pro tip of this episode. So as I mentioned, a weight reduction of overall 5 to 10% of body weight actually creates significant decrease in insulin resistance and decreases your A1C significantly, which is very, very good, not just for your diabetic health, but overall health, cardiovascular, renal, your brain function, your eyes, everything. So how do you decrease that weight? How do you get that 5 to 10% overall weight reduction? 2 ways. The first thing is interrupt that sedentary behavior. So if you are sitting for 8 hours a day, every 1 to 2 hours, do 8 to 10 squats. The second thing is interrupt your sedentary behavior. If you're sitting for 8 hours a day, at that 20 or 30 minute mark, get up and move. Interrupt that sitting. So as long as you're not sitting and as long as you're moving, if you've interrupted that sitting behavior, that will help decrease your A1C, decrease your insulin resistance, and on top of that, that will help your overall cardiovascular and musculoskeletal health. So thank you so much for listening to this episode all the way to the end. I really do appreciate it. If you feel like you have taken away any valuable information that you can implement in your own lifestyle or would like to share with your friends and family, please don't forget to share and subscribe to Wellness Chronicles. This helps me make more content for you that is evidence-based, so that way we can have a healthier, happier community. So until next time, please stay happy, healthy, and kind.